Hey everybody, welcome to the Recovery Clinic. My name is Ashley and I'm a person in long-term recovery. Today I have got a big old party going up in here. Whoop, whoop, whoop. I've got Misty Evans and I've got Russell Boyd here today. We had a very interesting week this week. Russell and Misty just got started at DHS. Yeah! So, the other day it was Jimmy's birthday, and all of us gathered together and sang happy birthday to Jimmy in the middle of DHS. And he said he looked up and it was all recovering addicts, you know, all people in recovery. And we were all there singing happy birthday. He said it was the craziest thing ever. And it really was. It was so awesome to have a big family of us right there. We take it over. Taking over for sure. So today, guys, we're basically just gonna break it down, like what's going on at DHS, what's happening in peer support in the state, and where we need you, because we do need new peers. We need new faces. We want to get everybody engaged. And I don't know if you guys remember, but when Jared Harper, the assistant SAC for the DEA, was on here, he challenged us.
He did.
He did. He challenged us to fill up the stadium in Fayetteville with nothing but peers. And so we, you know, we're on a roll. We're wanting to do that. And, you know, we've got some really great things coming up. So we're going to kick this off with talking to our new DHS peers, and we are going to, I want to hear some of y'all's story, because I know bits and pieces, but I don't know your whole story, you know?
Yeah.
And so I just want to, we're going to start with Misty. Misty is our new peer supervisor at DHS. And so, you know, Misty, I heard a little bit about your story about, you know, thinking that you were going to be destitute in Taco Bell forever. And so, you know, I know that you have maneuvered through DHS long before you ever got where you are now. And I think your story is so inspiring, absolutely inspiring. So tell me about yourself.
Okay. So I started using when I was 12 years old. I also was diagnosed with some mental illness as well, kind of around before I started using. And then from there it progressed. You know, I went to jails, institutions, right? Experienced some death, almost with some overdoses, a couple overdoses in the hospital setting. So that's why I advocate for peer support in the hospital setting. And, you know, like, I felt like my life was limited. Like I was just going to be, that's who I was, a using person. I wasn't never going to amount to anything. I, you know, was then, from my adult life, I never actually worked until I got in recovery, right? And my first job was, you know, firehouse subs. That didn't work out very well, you know. Didn't know how to really be a productive member of society first. And then, you know, I really started working at the Taco Bell industry. And I thought, you know, yeah, I'm going to do this, you know, I'm going to, you know, try to be a manager or something like that. Well, if you're a convicted felon, certain industries, you can't be a manager in that area.
True.
Yeah.
So true. You're
and
limited.
Yeah, your life is kind of limited. And so how I got involved with peer support was, there was a man that kind of has been with me throughout my whole recovery process. His name was Jim Clark, and he handed me a peer recovery support specialist application through the drive-through window and said, Misty, you know, fill this out, take the time to fill this out. He knows that, you know, my passion was to help other people, to tell my story, to let people know that, hey, that's hope. Like, I was proud to be a productive member of society, walking to work, you know, showing up to work on time, learning how to do those skills.
And, you know, not to cut you off, but you skipped a whole lot of really great details in there.
Yeah.
You know, so go back and kind of navigate how you went through the DHS system
myself.
and the Social Security system, like all of it, because I think it's so powerful how you got where you are. You just don't give yourself enough credit, I don't think.
Thank you. Well, so like I said, I was diagnosed with a mental health diagnosis, and from there, I was told that I couldn't work, that I had to take these medications, and so my life felt really limited. And so I was diagnosed with manic depressive bipolar disorder, and so I'm pretty open about that. And, you know, I was put on Social Security.
Right.
And for me, sitting at home, not being able to feel like a productive member of society was paralyzing.
Right.
And so I navigated off of the Social Security system when I got into recovery, when I got clean. I decided to make the decision that, hey, I'm going to try to do some part-time work, you know, and see what that looks like. Take my medication as prescribed and see what that looks like, right? And I was able to be a productive member of society.
Right. And that's just so, it's such a fantastic story, because I know, for myself included, there was a period of time where my parents felt like I needed to apply for Social Security because, just like you, I had been labeled with some mental challenges, and I couldn't, the longest I had ever held a job down was, you know, a year, and that was a struggle. You know, and that was even prior to my drug use. So, you know, during my drug use, we're talking maybe 2 or 3 weeks. Maybe. And that was if I didn't, you know, if I showed up that long. So, you know, I think it's so amazing that you went from having a comfortable, well, I don't know about comfortable, but having, you know, the ability to say, I have income coming in every single month, period, in the story, and taking that big leap of faith.
Right.
You know, believing in God and taking that leap of faith. I can be a productive member of society. I can do this. And look at you now. I mean, that's just, I mean, your story is truly inspiring to me.
Thank you.
And, you know, I have met a couple of other people who have, and it's very few and far between, that have done the same thing.
Right.
And I just, I think it's so...
There's a lot of fear.
There is. I would be terrified.
There's a lot of fear of the unknown, like what's going to happen if I have another, you know, episode. You know, what is that going to look like? You know, who is going to be in my corner when that does happen? You know, that's why the RAP plan is so, you know, important for people with substance abuse or mental health challenges to have a RAP plan. Like, who's going to be in your corner? What, you know, who's going to make some decisions when some things happen?
That's right.
Prepared.
Being prepared. Right.
Yeah.
Right.
Well, I think your story is just phenomenal, and there's so many little intricacies. So when you got into peer recovery, you just told us that, you know, somebody that you knew came through the drive-through where you were and said, here's try this.
Yeah.
You know?
Yeah.
So lead me through your first few years as a peer.
Okay. So I did my first peer core training 2018 in July. And then after that, I started, you know, volunteering on the weekends. I'd work Monday through Friday at Taco Bell, and then do Friday and Sunday volunteer work at Next Step. And so I'd go there and I'd volunteer with some of the women there, you know, help them get to resources, help them get to meetings, you know, share my story with them, lead peer-led groups there. That was my first introduction into peer work.
And so what was Next Step again?
It's a transitional living for women.
Right, okay. And so you got to go with women who had maybe just gotten out of rehab, or had just kind of entered into this new sober type of life, into recovery.
New in recovery.
Right, and so I know whenever, you know, I went to rehab several times, but, you know, in the beginning, whenever I first heard, you know, you're going to get out and, you know, go into sober living, and I had no clue what that looked like. And then whenever I did do it, it was, you know, walking everywhere to try to find a job. And, you know, if you don't have someone who's been there, who's navigated that, who's done that, it's difficult. It's hard. And so that's what you did.
Yeah, I helped them, you know, when times would get overwhelming, you know, with their insurance, you know, trying to get them on some insurance, trying to get them on, you know, some food stamps or something like that, just trying to help better their life, get them to work, things like that. Because, and actually the funny thing is I lived in sober living during this time. So I lived at Wilberty Mills in the sober living community
Right.
myself. So I'm living in this sober community, and then I'm going on the weekends to go to another sober community and help other women, you know. So it's pretty inspiring, and it gave me a hope and purpose.
Speaking of purpose, you did something else right after that. You got hired at
Bradford Health.
Yes, and talk a little bit about what you did there, because that's an amazing story as well.
So Dory Haddock, she was my former boss. She took a leap of faith and believed in me and hired me. And so she's found out within 4 months of being there, you know, this girl's got pretty good work ethic.
Right.
You know, she's got a really good story. And so, you know, she was working on the program with St. Vincent's, which is now the addiction recovery program with St. Vincent's,
right,
inside of a hospital. And they have peer groups there, one-on-ones. We also go down to the emergency room and talk to peers and, you know, wait with them while they're waiting down there in that area, because that's kind of a traumatic experience. Being in an emergency room, you're coming to treatment, you're scared, you know, you could leave at any time and go back out. You know, so having someone there to sit with you and kind of talk with you and calm your nerves, you know, it makes a huge difference.
And you also talked about, I actually came to see you one time there to visit, and I mean, it's a phenomenal setting. I mean, you guys did all kinds of things to make sure that it didn't feel like you were in a hospital setting.
Right, in a hospital setting.
And so one of the other things that you talked about at the time was that you guys went up to the psych unit. And you talked to people there. And I know for myself, I had numerous trips to the psych unit.
Right.
And I never had that person who said, hey, I've been exactly where you are.
Right.
If you want to do something different, let's try it.
Right.
And I think that's so phenomenal. You know, it's just an amazing thing. And then that leads you to where you are now.
Yes.
And so
DHS.
what are you doing exactly at DHS?
So actually merging the peer support as one. So it looks as behavioral health, substance abuse, and mental health is one united. We're not looking at it separately anymore. We're trying to look at it as one as a whole. And so that's kind of what brings me to DHS, is kind of work on this program.
That is awesome. That's awesome. And so we have Russell Boyd here. And so he is working with Misty.
Yeah, she's my boss.
She's your boss.
Yeah.
That's right. And so, Russell, you've got a great story as well. I mean, and it's so, I keep using the word inspiring, but that's just all, that's the word that there is that it's awe-inspiring to see people like us in the middle of DHS. And so tell me about yourself. Tell me, where did you, go back? Tell me about your story.
Well, I'm originally from Albuquerque, New Mexico. So my dad, he's from out here. So we came down here like in the 90s and ended up building a house and stuff like that. But I started my drug use probably around almost the same age, around 12 or something like that. Just started, it's a progressive illness, and you start smoking weed, then you do this, and let me try this, and eventually you find yourself in a dark place, which I did, and the years just kept like disappearing real quick, and you do crazy things to get more drugs, and I found myself going in and out of prison like real quick. I was more so in prison more than out of it, out of prison. So that's where I first heard about peer support recovery, and we was already doing it. Like I heard about it in Think Legacy in a program in prison. We was already doing it, but we didn't know what we were doing.
Right, didn't call it peer support.
Yeah, we didn't call it peer support. We were just in-house counselors, and we would counsel each other. The staff barely came in there, in the barracks where we were at. So every morning we would facilitate classes. We would make sure people got their homework turned in and all that. If guys needed to talk, they would come to your rack and you would talk it out or whatever. We were self-governed. So yeah, we were already doing this. We just didn't know what we were doing. So until one of the guys, his baby mama was doing this peer support on the streets. So she told us about it, you know, come look at it when you get out. And I think it was 2019, the first conference. I had went to go look at it, and I met Jimmy. I knew a couple of people that was already peer support specialists. When I got there, you know, I didn't know, like Casey, I didn't know that he was a peer support. I knew him from the past, but when I got there, I was like, yeah, there's Casey. And he told me everything, so that's how I kind of got started.
So you first got introduced to peer recovery at the 2019 conference.
No, when I was on vacation.
Mean, whenever when you were on vacation, right? And so that's funny because I say I was at the spa.
Yeah.
Whenever I have all those missing periods of time, I was at the spa. My grandmother taught me to say that long ago, and it was hilarious. She would say, well, Ashley was at the spa, so no. And so when you got out and you first sought trying to become a peer, really learning what it was about in the free world, I guess. So you went to the 2019 conference, and that's kind of, you saw, and that was the same thing for me. You know, I knew about it, but and I actually met Misty for the first time at the peer support conference, and
we
so
just pulled you on into the volunteer services.
You did. I mean, I walked in and she said, "Here, stuffed bags," and so that was how I got introduced, and that was it was an amazing way, you know, really, and so. And same for me. Bonnie Stribling was there, and I knew Bonnie from Russellville, Las Vegas. I knew Bonnie from Las Vegas, you know, and whenever I had gone to the spa in Russellville once before. So, and it was so crazy to see all these people that I knew from all over the state where I had been in recovery at some point in all these different places. And so it sounds like you kind of had that same experience, and that's just awesome. Like, it's just so amazing. And so what at that point, where were you at in life whenever you first decided you know, explain a little bit about that.
Yeah, so I had just came home from vacation, and I was kind of behind, so but that first week I got out, I got enrolled in college, and I think that next week is when I went to the conference, something like that. It's real close. So I think a couple months went down. I applied. They picked my application. So I think 2 more months I'm about to go to the training.
Right.
But somewhere in between there, I was asked to come to Placid County and share my story. And Sheriff Higgins had a program. Well, he still has a program, but it was a pilot program at that time for the women. So I go there, I tell my story. They kind of, like you did her, hey, come volunteer. So, but let me rewind. While I was on vacation, I told God, I was like, I don't know what you want me to do. I know I want to submit and do it. I don't know what it's gonna look like. I just know I'm tired of doing this. So I'll be a vessel, just whatever you want me to do, I'll do it. So when I started volunteering at the jail, it was amazing to me. I'm like, man, I'm walking around the jail. You know what I mean?
I'm not stuck behind the bars. I'm in front of them.
I'm not walking around in flip-flops or nothing like that. But I'm coming in and bringing a message of hope and showing the men and women that, you know, we do recover. So I started there volunteering. I volunteered there for a year, a little over a year. So I'd ration my school money, and I would live off of my school money. And I told myself, man, they're gonna have to beat me away from this county jail. So from 7 o'clock in the morning until like 4 o'clock in the afternoon, I'd be volunteering there.
That is incredible.
For the longest, the staff was like, they thought I got paid. They thought, but I was like, nah, man, I'm volunteering. But and I wasn't volunteering to get a job there. I was just volunteering to pour back into those men and women because I thought it was a cool experience. Because what Sheriff Higgins was doing at that time never been done before in that county jail, which is the biggest county jail in this whole state. So it was mind blowing to me just to be a part of it. It never registered to me that, you know, you might want to try to get a job. You know, 'cause I didn't think that far. I just was like, I'm just gonna keep volunteering, going to school. But yeah, I ended up getting a job there. I can't remember how it happened. It just happened. And so the sheriff was like, hey, you want to start a pilot program with the men? So that's what I did. Started a little pilot program with them. And I did that for, I think, about another year.
So what did you do with the men whenever you were in that pilot program? Like, what did it entail?
Just peer support, another peer support program, kind of, basically.
Yeah, that's just, it's amazing. And I'm sure at some point, maybe not, but I'm sure at some point there was even the question of, can I get hired, right? With someone that had, you know, lots of vacation time
Yeah.
on their background, you know? And so, and it, you know, which just leads me into where you are today, which is just phenomenal. And so, okay, so you did that pilot program there for a while, and then what happened next?
So if the sheriff was here, he'll tell you I got stolen. I went to work for another foundation called Restore Hope.
Right.
So I worked for them for a little while. And so working with them, I worked with men in reentry. So they were still incarcerated, but they lived out here. They had like 5 months left. We helped them get a job. We helped them get a car. Helped them get their own place. It's called Hidden Creek.
Right.
And BJ owns that.
BJ Brady?
Yeah. So, yeah, now that I sit and think about it, now that I'm thinking about it, I really don't think about it, but God, I guess God will answer your prayers, because if you would have told me I'm going to leave vacation, I'm going to get off vacation and turn right back around.
And hang out at vacation.
Yeah.
Hang out in that same environment. Yeah.
But while I was doing it, I never, like, the passion and drive and it inside of me, it never registered. It just now registered, like, to me right now.
Right. I think sometimes we don't give ourselves enough credit, you know? I know Misty tells me that all the time. Yeah. I'm so grateful to have her in my life, because she just, and I keep telling her my head's going to be so big I can't get through a doorway. But that's what we do.
Yeah.
That's what peer support is about. Right. And so, you know, I'm sitting and I'm thinking that I stink at money management. I don't know if you guys know that or not, but I'm horrible with it. And I'm listening to Russell's story, and you have all this time where you've been locked up, and then you get out and you have been taught how to ration your school money so that you can go help these other people. And that's dedication right there. That's real deal stuff, you know? To have enough passion and love for people that are just like us, that you sit back and you go, okay, I have to really watch what I'm doing here so that I can remain of service.
Yeah, I mean, and the reason that where that passion comes for me is through the process of, you know, me recovering from being on vacation to being out here to getting enrolled in college and all this type of stuff. There was nobody like me with a background like me to help somebody like me.
Right.
If that makes sense.
It makes complete sense.
Yeah. So I want to be that person for that person like me,
right,
that can identify like me, you know, that has the gang banging background, that has the you name it kind of background.
Right.
You know.
And that's just I hate using the word inspiring over and over again, but it is, you know, because all of our histories look the same, but they all look a little different, you know. And so Missy and ours looks a lot alike, you know. And so there's a lot of parts of your story that I don't identify with, but I look at you and I think, oh my goodness, like you have overcome so much, and that's, you know, I know that you give all of that glory to God, just like we do, you know, and I think it's just so amazing to hear that story. And so, not only that, how long have you been off vacation?
Off vacation, probably like 3 years.
Right, and you've already gone flat, right?
Yeah.
That is, and for anybody who doesn't know what that means, can you explain it to us?
Well, now, since I'm not on paper no more, meaning I'm not on parole or probation, I'm free.
Yeah,
Yeah.
you're free.
I'm somewhat free. So, yeah, I'm free.
Yeah, and I mean, 3 years out.
Yeah.
I mean, you know, that's a big deal. That's a big deal.
I think percentage-wise or statistics-wise, and I'm not saying this or bringing this up to toot my own horn or nothing, but I think I'm in the percentile of like a 1%.
Yeah, for sure.
That gets out and does all this and doesn't go back.
I mean, you know, and right now recidivism rates are through the roof.
Yeah.
Right.
And so what I'm hearing in your story, because you said that you first were introduced to peer support when you were in the prison system.
Right.
But it wasn't called that. It was called something else. But that's where you first experienced it. And so what I think is a great lesson there, and I've actually read reports from other states that have true peer support in the prison systems, and the recidivism rate goes from 72% to like 23%.
Yeah, I mean, because the games and all that, the buck stops here. Like, if I'm down there with those guys, I mean, they can't pull the wool over my eyes. They can't tell me. I know it all. I've done it all. I've seen it all.
And you know, it's comfortable to go back to what you were in, right?
Right, absolutely.
And so that's why that's why we keep going back. We keep going back. We keep catching more cases and things like that, because sometimes it's hard for us to believe in ourselves, and so we're comfortable in the mess and the chaos. And so when somebody that's been through the chaos and the mess comes to us and is like, hey man, I was the same way, like,
and you don't have to do it anymore.
And you don't have to live that way anymore. And it's like, what? I don't have to live that way anymore. Like, I didn't know there was another way.
Right.
I didn't know there was another way until I came into a recovery community and atmosphere, actually went to treatment, did the sober living, then started working, and then, you know, started doing, you know, I was on paper as well, and I worked hard. I got off 2 years early to take the job with Bradford.
That is awesome.
Because I was going to try to work at the Pulaski County Jail, you know, but that wasn't what God wanted for me at that time.
Right.
And so just, I mean, it's hope, man.
It is hope.
That was the best experience through my journey is working at the Pulaski County Jail. I had room to grow. I had room to mess up. I had room to learn. Nobody judged me or anything like that. I had room to learn how to make spreadsheets.
Yes, we have to learn.
Every
Yeah.
week.
Yeah. So, you know, and the reason I wanted you guys to come and tell us about your backgrounds and your histories is because we do have this giant merger, this great thing that has happened.
Right.
And so we aren't looking at peers as mental health peers versus substance use peers anymore. And which is a great thing, because I know there's a lot of people like us where we fall into both categories.
Right.
Yeah, when I was 17, I went to federal prison and I got diagnosed with mental health issues. They threw a lot of prescriptions at me.
Right.
You know, so they threw a lot. I was my behavior wasn't really good at 19, 20 years old in prison.
Well, that's why it's behavioral health
Yeah.
right now.
That's
So
right.
it's
That's why
one.
it's all encompassing.
Yeah.
And so what I think is great is that you guys do bring that message of hope. Like, you know, it is great to have someone, and I know you mentioned earlier that you're still a little uncomfortable with showing them, and that's okay, but I think it's great to have somebody who's all tatted from head to toe, literally from head to toe, in DHS. Like, that's a message of hope right there. That means that, you know, you definitely not only don't have to live that way anymore, but you can help others not live that way anymore. And so I know
stigma.
It is. It's breaking stigma.
I thought you was going to say, if Russ can do it,
if Russ can do it, anybody can do it.
You can do it.
Yeah, that's right.
And so, yeah, I mean, it's phenomenal. And so from someone who, you know, was labeled for their entire life as a diagnosis and told you can never do anything again, here's some money because you aren't going to amount to anything. Yeah. Just take a time out, just sit over here, and we're going to give you some money, and now look at you, you know?
Yeah.
And then literally, like in the top percentile, you know, and I think that just goes to show that we can do something. We don't have to live this way anymore.
We can do something with a little bit of support, right?
That's right, a little bit of peer support.
Somebody walk along with us.
And that's all you really need.
Yeah.
It is. It really is. And so I know for myself, whenever I first got introduced to peer support at the conference, and I had somebody who was a peer support specialist, and still do, JD's out there, my significant other, and he, you know, he guided me, he helped me because he had gone through everything that I had been through, and so, and that was my missing piece.
Yeah.
That's what kept me on this side. You know, instead of having that constant stigma where, you know, you're always going to be a diagnosis. You're always going to be, you know, and I'm not now. Right. You know, it's normal for me to be abnormal, which I love, absolutely love. I wouldn't have it any other way. And so, let's talk now. We've got your boss, Tammy Alexander. Yes. And she works at DHS. She wanted you to share a little bit about what we got going on.
Yeah. So we have some job opportunities coming up for the state of Arkansas. We are recruiting peer support specialists, you know, as many as we can. If you have lived experience, whatever that may be, just let us know, you know, call us. You have the number, correct?
I do have the number.
Can you share that with us?
I do. So just a little bit of qualification here.
Right.
If you have 2 years sustained recovery.
Right.
That means in a row. 2 years of sustained recovery and no sex charges and no murder charges.
Right.
If you meet those qualifications, we want you. The state of Arkansas needs you desperately. Right. And I've got a phone number here if anybody wants it. It's 501-318-7184. Just dial that number. You can also text that number. It is a textable number. And that way you guys can get, you know, roped into this because we still have, how many counties do we still have? I think it's 26 that we still need. Right. I could be wrong, but I'm pretty sure it's 26.
There's 75 total, so we have to have
and we had 28 and I think we're down to 26. There's still 26 counties in the state of Arkansas that don't have peer support.
And we want those peer supports in our court systems.
That's right.
With our DHS caseworkers, we want the peer support with them. We want the peer support in our hospitals. We want the peer support anywhere somebody is struggling or going through a system. We want peer support in that category
to help guide them through.
That's right. Yeah. I think we're even launching into prison systems.
Right.
So you know, and which is just that. I think that and the court systems, for some reason, those are the two not most exciting. I hate to use the word most, but really exciting.
It's the most active place.
It is because, you know, what would happen to our community? You know, not even just money we would save, but, you know, jobs, financial, all of those things if our recidivism rate dropped.
And I want to talk about, you know, our Arkansas model has that mental health and substance abuse combined. So we're doing trainings with you, you know, specific for both of that, like both of those.
It lasts an extra day.
And it lasts an extra day due to that. It was like, what, 3 days, and now it's 5 days. And so we're also looking into specialized trainings as well. So when we put these peers, an extra training. So we put these peers in these, hospitals, courtrooms, things like that. We want to make sure that they have the training that they need to work with individuals.
Right. So any kind of specialty training, you guys, so that means if you're going into the court systems, you need to, clearly, we want to make sure that you know how to navigate that system. And so, I imagine Russell probably knows a lot about that court system, don't you?
Yeah.
Yeah. And so, that's where that lived experience comes in, and it's so vital to have that lived experience to be able to bring hope to others.
Yeah, to deal with the emotions of the lived experience, because I went from being in the courtroom, getting sentenced to vacation, to turning around, getting out on vacation, and going to court with peers. And I can remember the first time I did it, my heart was beating so fast, like I could hear it in my ears and in my neck. I could feel the blood just boom, 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 boom. And I'm like, man, I'm not about to get sentenced, you know what I mean? But I had to talk to the judge, and I can remember the first time the judge told me, put your hand up to swear on the oath. I was like, what's going on?
That's just traumatic.
And so what's great is to be on the other side of that and to be able to stand up and say, hey, look, I'm standing here with this person, and I'm telling you, if I can do it, they can do it. And that's, that's advocating, and that we do that as well. That's going to be part of what we do for each other. And so I'm so excied about this. Is there anything else that you wanted to talk about?
I definitely want to I just want to, put the word out, like, if you have lived experience and do have 2 years abstinence, to please, don't sell yourself short. Like, give yourself the opportunity to help other people with your story, because your story is what's important. Like, somebody might not have had your experience. So your experience is way more. It can't be bought, taught, or replicated, right?
No.
I can't even speak. Like Jimmy says, it can't.
No.
And that's one of our major assets is our story.
It is.
And share it with other people. Get involved in your community, whatever that may be. Volunteer, food kitchens, just things anywhere where there's people. Volunteer, get out there. And share your story with other people. You can save lives.
Breaking that stigma, man.
Yeah.
Breaking that stigma. And so what's so great is to be able to stand up in DHS and be breaking stigma all around.
Yeah.
Yeah. So, like, as Jimmy said, and he talks about it all the time, for so long there was that statute of limitations that you had. If you were a felon, you could not work for the state of Arkansas, but God made those rules, God made those statutes, and God decided to change them.
That's right.
And now we've got a whole team of us up there.
That's right.
And I mean, and you can be with us, I mean, that's what it's just taking off, it's taking flight. And in the last few months, from April until now, being beside Jimmy and everything that he does, I have seen things just take flight, and it is so exciting to be right there in the middle of it. And you know what? If you've got that lived experience, you can be right in the middle of it too.
And my passion is, I lost a child to adoption, right? And so I've done a 180, right? The state said that I was an unfit mom at the time, and I very well was. I wasn't, right on my medications. I started using substances. I was too scared to tell the DHS system that, hey, I need some help, because I didn't want anything else put against me. Like, I was scared to talk about it. And so that's why it's such a passion for me to talk about, right? Like, I was the single mom struggling and was scared and didn't want to tell anybody that, hey, I need some help, but I want my daughter. Like, I don't want to lose her. And so my daughter was adopted, and now I'm working for the state, DHS, Department of Human Services. Like, it's a 180. When I first got the phone call for the interview, like I literally started crying.
Yeah.
I literally started crying because I haven't heard somebody from DHS call my phone in over 9 years.
And
Right.
the only time they were calling you
Yeah.
before was not with good
Was not a
news.
very good,
Right.
you know, and it was scary. And I feel like, you know, if I would have had maybe a peer support specialist or somebody there that I could have probably spoke to with lived experience. So lived experience means, you know, like another woman that had lost her child.
Right.
I would have been able to talk to her and how did she get through it? How
Right.
did she get through this process? And so that's the message that we want to go, you know, give out, is that your lived experience matters. And a lot of us are ashamed of it.
Mm-hmm.
A lot of us feel guilty and just it's so many emotions, but that is what fuels the fire.
It is.
Yeah.
It is. And so I'm so excited to get to be a part of this. I'm so excited to get to be here with Misty because she's someone that, you know, from day one of being introduced to peer support, literally day one, literally one of the first 3 people that I met, you know, and here we sit.
Yeah.
Who would have ever
Wow.
thought that?
Yeah.
Who would have ever
Yeah.
dreamt that? So, okay, well, guys, I mean, we could go on forever. That's what we do. We talk, right?
All day.
So all day, every day. I'm exceptional at talking. But what I want to do is I want to give you guys the next few minutes. We'll just get, you know, guys take turns. You can talk together however you want to do it. But let's do a message of hope right here and just, you know, say what you want the audience to know. Reach out about peer support, whatever you want to say. Give that message of hope. I'm just so excited to be here.
Why don't you go first?
Yeah, so I guess my message of hope would be that there's nobody like you. You're unique, you're one of a kind, and there's a reason why you was made the way you are, and the things you went through, they have purpose. And it's important that you try to help somebody struggling with the same things that you are.
That's right. That's awesome.
And I just want to say, don't let shame and guilt, you know, tie you down anymore. There is hope. There is a better way to live. Your story is what makes you. It's your biggest asset. Speak up. Speak up because we need you more than anyone else. I mean, there's so many people dying, taking their own lives because they feel alone. And we need to let other people know that they are not alone, that we have an army and we are creating an army of peers.
And you're part of that army.
And you're a part of that.
You are a part of that army, absolutely. Guys, today was amazing, wasn't it?
Yes.
I mean, this is the kind of party we got going on all day, every day. So, guys, I just want to say one more time, if you are interested in being a peer support specialist, that means that even if you have only mental health challenges, that you've never had that substance use issue, if it's just mental health, we want you.
We need you.
If it's just substance use, we need you. If you are all of the above, like all of us are,
I'm all of the above.
we need you, okay? So, you know, your lived experience is so, so, so desperately important. And so I'm going to give that phone number one more time, and that's 501-318-7184. You can text that number. And, you know, please just no sex charges, no murder charges, and have 2 years of sustained recovery. We want you. We need you. Thank you guys so, so much for tuning in today. We really appreciate it. We hope you have a fantastic week, and we will see you again soon. Bye.
Bye.